My name is Kerr, and I'm a practicing endodontist here. One of the first things I was thinking about when bringing the Nomad into my practice was, how efficient is it going to be for my staff? How safe is it going to be for my staff? And is the quality going to be high enough for me to get a diagnostic radiograph from?
It just seems like it's a lot faster for the patient. There's so much stigmatism around x-rays. Now, like, if they see me right there in the room, I think it's gonna make them even more comfortable to know, like, oh, she didn't even have to go out. That, and I can see if they're holding the x-ray properly. Sometimes it'll move, and then I'd have to take another x-ray, and so if I'm right there, I can see if it moves and readjust it.
We're known for our comfort. Look, a lot of people can do root canals, but it's what the service that you bring them that's really going to separate you from your competition, and that's what we're doing at our office. Safety for my staff was #1 issue, and the second part was what was the quality of the film. So when I did a side-by-side comparison, when I used the wall-mounted versus a Nomad, I could not tell the difference of which one was which. When I'm looking at a two-dimensional film, the quality of the image has to be of the highest importance, because if I can't see what I need to find in that canal, if it's blurry or if there's a lot of movement by the patient, I'm gonna have to take the film over and over again. I find that when I'm using my Nomad, I do not have to do that. Speed is important because we take a lot of radiographs during a procedure. And when you're in the middle of a procedure and you want to set up the x-ray and you're looking to get the wall mount set up, sometimes there's drifting and it just doesn't give me the quality that I need. So I just needed something that was a little bit quicker and a little bit more reliable. And some of the practices I work at, there's 9 operatories and actually only 2 wall-mounted units. So to be able to use it between the operatories really keeps the efficiency of the flow of patients going well. The battery life is great on it, and we noticed that we don't have to charge it in the middle of the day, and it's ready to go for the whole day for all of our patients. And we have a 2-doctor practice, so we see a lot of patients a day.
It's very comfortable. You put the one hand under the end of it and then you hold on to the handle, and the handle is very comfortable to hold on to. And when you hold it properly, it's very balanced in your hands. We have wall units that are very hard to use, but I would prefer to use the Nomad all day long compared to trying to move that.
So when I'm looking at something, I do the research on it. I take a look and make sure that the clinical research is just as strong as the basic science research. And when I saw that the research was strong for the Nomad, it was an easy decision to use it in our practice.